tasks.
Okay.
Very tasks are very simple.
I study better difficult. Only for you, simple professor.
No.
Yes, start. Yes, with you. Diagram.
Just
For the first one,
I want to answer, to get answer from students from this place.
for everybody together.
Diagnosis.
so for the first clinical task, this woman is having infection, infection.
Oh, dear doctors, we must make up diagnosis. Diagnosis involve only 2-3 sentences. That's all. Diagnose what?
Dia nak jawab dia nak jawab tu. You just cakap je satu macam-macam.
Yes, the next student, our chief. Chief, you must know. Yes, only myoma. Myoma. Only myoma. That's all.
You think
Can I go ahead?
yes.
Pelvic inflammatory disease with tubular ovarian cyst, myoma that cause infection.
You must make up diagnosis. That's correct diagnosis. The first place in this diagnosis is very dangerous pathology. Speak.
I cannot word it.
You want me to say in 2-3 words only.
Tubular ovarian abscess, I think.
That means you mean tubular ovarian myoma.
Actually, it's very simple task.
Yeah.
Very simple.
Yes, but we can't
Yes.
figure how to word it.
Yes, chief, you are diagnosis.
How actually you want to explain diagnosis?
Your answer или что, или мы обсуждаем?
Example, please.
Tubular ovarian infection.
Yes.
Чуба,
Tubular
Tubular ovarian infection
infection.
Myoma.
caused by
Abscess.
Ну, это примерно звучит как вот если это сказать, что у больного там пневмония или тяжелое состояние, да, the patient in very bad condition. No, it is maybe influence. Maybe.
The waste
Maybe. This not correct, not individual. This
expression.
yes, around 1, 2, 3. The third student diagnose.
Might be pelvic inflammatory disease.
What?
Pelvic inflammatory disease.
Pelvic inflammatory disease. Ну, нет такого диагноза. Pelvic inflammatory disease, да? Ну, перевожу на русский, чтобы мне понять не было, да? Тазовое воспаление, ну, такого нет. Нет. Pelvic disease. What's the pelvic disease? What is a pelvic disease? Inflammation. Ну, это тазовая воспалительная болезнь. Ну, это is not correct, not individual. That is nothing about nothing. Yes, the next student. What's your opinion?
Gimana?
No, it's very simple.
Ayo saya satu benda yang tadi saya potong.
What
Yang
diagnosis?
saya
Then
buat.
access.
What?
Access. Access. Access.
Ну, дальше. Абсцесс чего? Абсцесс вот.
Yeah, you want to
Абсцесс. Что такое абсцесс? What is the abscess?
Ovarian abscess.
Ovarian abscess. Not. What else must be in this diagnosis? Not only ovarian.
Subperitoneal myoma. No.
И что? Я понимаю, что вам очень нравится диагноз майома. You like diagnosis myoma, да? Myoma may be in only of patients. Myoma. What must we to do? Conservative treatment. But this not. This is high temperature. Yes. We must start enough. Да. Next student. What your opinion?
I think this patient has
Вот что-то говорит человек
because,
и начинает. Я думаю, что конкретный диагноз можно
say lovely, just say what lovely, whatever
See
you
this whatever you have.
Blue little please.
peritonitis.
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 The cause of peritonitis. Peritonitis.
Infection.
Peritonitis, perioperitonitis. What cause?
Infection, chlamydia, gonorrhea.
No infection from what?
What about
From the ovaries.
What?
appendicitis?
Да.
Differential diagnosis.
No.
Yes, we will.
What?
If we are on surgeon classes, maybe appendicitis. But you are at gynecology classes. What's the cause? It's very simple.
Ovarian.
No ovarian,
And
then
tubular.
else what?
Tubo-ovarian.
What? Tubo-ovarian,
Infection, abscess.
tubo-ovarian abscess,
Yes.
acute inflammatory disease, так? Tubo-ovarian abscess,
Yes.
and then rupture of this abscess.
Yes.
Perforation, maybe perforation. Перфорация тубоовариального абсцесса.
That's the diagnosis.
The perforation of tubo-ovarian abscess point perioperitonitis. Perioperitонит. Yes. Ну и по-английски, и по-латыни все будет периоперитонит. Perioperitонит. Is the diagnosis clear for all of us? Yes, yes. Acute tubo-ovarial abscess, perforation, perioperitonitis.
Professor,
Yes.
what is the reason for this? Is it because of IUD? Is this because of IUD?
What are you doing?
No, why is the ovarian abscess? How we understand?
EUD, intrauterine device. Yes. Yes.
The question is why.
Because
Yes, IUD.
Yeah.
Так, the second stage, we must what data from this task confirm our diagnosis. Do you understand?
Yes.
Yes. Yes. The next student, you. What data confirm this diagnosis? What data? Так, my dear doctor, it's very simple. Complaints, physical investigation, and apparatus methods. are base for
Ultrasound.
making up this diagnosis. You start.
Ultrasound.
Start. Basic. What data confirm this diagnosis?
Heteroscopy.
No, in the case, you want me to
Complaints.
Say from
Complaints.
Yeah, from the
Complaints.
case.
Pain in lower abdomen. Therefore, first, the second, fever to 35, weak, no, дальше там будет, да, weak, then,
Leukocytosis.
then, iud, how much iud intrauterine device stayed at this patient? 15 years. It's big. It's very big. Only any EU intrauterine device may stay only no 2 years. Only 2 years. And only Mirena with hydroxyprogesterone acetate may be stayed at 5 years. Then in data investigation, what the details of investigation confirmed our diagnosis. Then you please, you. Physical examination. Yes. No physical examination. Что такое physical examination? Palpation of abdomen and gynecological investigation. Вот. Ну, можно говорить погромче. Вы и так говорите, еще у вас интонации такие, что не совсем как-то на английский идут. Да, поэтому ну говорите погромче. Speak loudly.
Hysteroscopy.
Hysteroscopy. What date of physical examination confirmed our diagnosis? Palpation what? Palpation what organ? What abdomen? Because we now recognize symptom shocking bleeding. Yes. Then, what are the date confirm our diagnosis? These. You.
Oh, me. Ultrasound, me.
What?
Ultrasound.
Physical examination.
Oh.
No ultrasound.
Okay, physical examination.
Really?
Pelvic exam.
You work at hospital where is no ultrasound.
Okay.
You must work. Yes. You must make a diagnosis. Yes. What?
Palpation.
The palpation there, very big tumor, side of the uterus. Painful and painful, not displaceable. And what some findings, another finding confirmed. tumor right 15 to 10 centimeters, yes?
Yes.
And the similar formation palpate left 10 to 8 centimeters. Leukocytes, what about leukocytes? What the point the leukocytes? Infection, acute infection. Всем понятно?
Да.
It's clear for you.
Yes.
Все, да? Что мы можем сделать для подтверждения диагноза? Вот apparatus method we must to make up to confirm this diagnosis. Ultrasound, yes, maybe. Доплер можно, да, yes, сделали. Получим что-то. Что мы получим? Да, мы получим образование. We can recognize the formation of a very big size with pure. With pure. Yes.
Jangan
Pure
tanya
это
aku
ноль.
tahu pure.
Pure это ноль. Ultrasound signs of ultrasound sign of the pure gens capsule, pure gens complex. In this tuber-ovarian abscess.
So is that a tumor?
Yes. Yes.
You need to use stronger purple.
Is that a tumor? The biogenesis capsule that in the abscess.
Yes, abscess, yes, да. This is typical clinical situation. We must work with these patients some years ago. It's very difficult to, for diagnosis not difficult, for treatment difficult. Yes, what must we do? Because the first is tuber-ovarial abscess, two-sided, yes, endometritis, yes, then perforation of this abscess, and then perioperative. Why data is point to perioperative? Или why sign points to perforates? Периоперитонит. Периоперитонит указывает на то, что там уже разделилось это патологическое содержимое брюшной полости. Yes. Конечно, да. What must we do? What must we treat?
What must we treat?
What surgical? In what way and so on. How can we start to treatment? Antibiotics or not? What must we do about intrauterine device? Huh?
Take it up.
Remove?
Yes.
And if this is didn't remove, what must you do? Ну, не удаляется еще, ничего страшного.
Remove the whole.
Antibiotics.
Removal, maybe. So,
Cervix of the uterus, no?
yes,
Remove the cervix of the uterus.
no, if maybe chance we remove.
But
And it didn't. Nothing. Yes.
Antibiotics.
Antibiotics. What kind of antibiotics we must to start?
Gentamicin.
Antibiotic very spite reaction. Yes. Cephalosporin, thought of fourth generation.
Yes.
Very high and very strong antibiotics.
Yes.
Yes. We start, and then what must we do? Perioperatoritis. What must we do?
Train the
Surgery. What volume of surgery?
Small.
No, that.
Laparoscopy.
Maybe careful.
More laparoscopy. Ну, я бы сказал, что не надо. It's very difficult for laparoscopy.
It's very difficult.
Yeah.
Laparotomy then. It's very difficult or?
For laparoscopy?
Yeah.
Yes.
Laparotomy.
Yes, laparotomy.
Yes.
What incision of the anterior wall must you do? What incision?
Explorative, I think.
Explorative, what excision must we do? You must know there some incisions of in obstetrics and gynecology by Pfannenstiel, by Joel Cohen, and
Oh, yang tadi tu okey. Okey. Sikit-sikit. The one in
Dia ni pasti PE kita semua memang bodoh.
memang tak boleh.
Сейчас смотрим.
Tak boleh.
I mean kita baru belajar. Dia dah berapa
这
tahun
个
dah
正在看，我们部分正在看，他是长班子。
А кто так сделал? Здесь видно, здесь не видно.
I think
Кто так делал? Нет, когда так показывает, то здесь экран вот такой вот идет. Ну так вот получается. Нет. Да. Вот. Yes. Yes.
Yes.
Because this
Yeah.
some yes, this is incision by Pfannenstiel. This is by Joel Cohen. This is obstetricians to do by Caesarea. And this is what? Laparotomy. Immediate down.
Vertical incision.
Low middle laparotomy. Well, it's very simple. low middle laparotomy. In this case, what the incision we must choose? This or this?
What's the question again?
What?
In our case. In our case.
What method of incision, of laparotomy, what method of laparotomy we must choose?
This one?
This?
Yes.
No.
Velas?
No. Only these. Only these.
Oh, on the
Yes.
midline.
Only these.
Why?
Why?
Low middle laparotomy because if it's necessary, we must enlarge up by umbilicum left and enlarge up. So this is very simple stage to laparotomy. Only this, because the operation is very difficult, because intestinal and colon were very close to uterus, to appendix, to tubo-ovarian abscess. And maybe surgeon must to operate this case, to help us. Clear to you?
Thank you.
Диагностика несложная, а лечение
One.
сложное. Да.
Are you ready to give
И только вот из этого разреза мы можем все осушить, убрать все гнойники. We must to eradicate only places where is pure and to cure our patient. Так. It's clear for you this task. Yes. Hard task. No. Yes. Clinical task number 2.
Maybe you want to.
The thing is, they literally repeat after you just kalau macam ni, kita kita balik.
Так, ну давайте. Let's start to make up diagnosis. What's your opinion? You. What the diagnosis? The correct diagnosis. Young women. What diagnosis?
It's almost the same.
Variances.
Tubular infection.
Acute inflammatory disease. Yes, but this is not correct. This is very don't say. Ну, кто сказал? Говорите, да. Repeat. Repeat, please, very loudly.
Tubular infection.
Yes, what? What? This. Salpingo-ophorite.
Yes, something like that.
Acute salpingo-ophorite. Острый salpingo-ophorite. And what is this? What is this? fallopian tube with a dense capsule. And this isthmogenous internal structure with purulent contents. What is this? This abscess of tube.
Yes.
Tubal abscess. Tubal abscess. What must we do? What must we do? The patient is young. History of one artificial abortion and without no any childhood. What must we treat? No, ectomy is very simple. Yeah.
Yeah.
But what must we do? Treatment? What? What?
Why is spectrum antibiotic?
What?
Cephalosporins.
Yes, antibiotics, yes, intravenous infusion therapy. Then, what must we do with abscess of tuba?
Drainage.
With training.
What?
Drainage.
Drainage. With laparoscopy, we puncture this abscess that involve the purulent contents and drainage this place. Only this. Only this.
Professor, why we cannot drain the previous question?
It's peritonitis everywhere, so you have to drink all of it.
We have to remove everything.
It's already.
When we discuss what must we do, the treatment, we may involve the age of our patient, the history of childhood, yes, the very big of involvement of infections, this 3 to 8 millimeters purulent, and then 10 to 15 centimeters from other side. And perioperitonitis. This no perioperitonitis.
So this one drains previous one.
Yes. This very different, because the infectious just the same, maybe gonorrhea, maybe chlamydios, maybe trichomonas, and maybe the another infections, mixed infections, staphylococcus, streptococcus, usual infections, usual. In these places, mixed infections. It's clear for you. This. The clinical task number 3.
The same thing but worse.
Same thing but worse.
It's
Yeah.
It's like
Yes.
the size is larger. The previous one was.
This is inflammatory disease.
Yes.
Tapi yang tadi 38. Tadi 38.
Millimeter.
68 ni.
Sebenarnya 3 to 8 millimeter, now it's 6 to 8 centimeters. So it's not.
So then tadi
sampai
sampai
peritonnya. Sampai periton. Jadi lah, aku sudah istri belum periton.
Ya.
Oh my God, diagnose. You, please.
Salpingo-operatis, yes.
Salpingo-operatis. Yes?
Yes.
Maybe. And your opinion? The next student? What do you think about diagnosis? What is this?
Slipping or something.
Solving of rays, yes. What do you think? What is this?
No?
What is this?
What?
No.
It's painful. Abscess.
Yeah.
To the right of the uterus, formation a limited mobile, painful, up to 6 to 8 centimeters.
Abscess.
Yeah.
Are you sure this is
It's too much.
What is this?
tu pensava nesse dia?
Allora,
6 centimetri kilo.
that's why I'm ready to be.
But for ovary là ini terbesar banget.
It's the same case as before, but the size is huge.
But there's no sign. But the previous one was not there.
It's tasty, painful.
What?
It's an abscess.
Ну, абсцесс. Ну, а почему вот все время абсцесс?
Да.
Что-нибудь есть еще в гинекологии? Ничего. Вообще, myoma and inflammation disease. What must we do? Surgery. What? Eradicate. What is this? This is formation, yes, formation, painful, limited mobile, that may be twist of the leg of the cyst of ovary.
Which one is ovarian?
Twist of the leg of ovary. What must we do? You must repeat the data about cyst and about complications of cyst for next lesson. What must we do? Maybe twist complete, maybe twist incomplete. In both cases, we must operate. But if there is incomplete, we must only a resection of the ovary. Yes, eradicate of pathology, area of ovary. Yes, and if twist is complete, unfortunately, we must eradicate appendages, tube and ovary. Yes, because this formation is with necrosis. What must we do with necrotic tissue? We must eradicate. Так. It's clear for you. Да, уже не только миома, да, но уже... Так, последняя задача. The last task.
Polycystic ovary.
那我应该是诊断或者治疗了。完了，治疗是啥呀？操药他今天说啥药？
Why?
Sis lagi bukan twist.
Dia kata incomplete or complete twist.
Method of contraception. What must we do? What contraception?
You have to select the method.
Да, yes, method of contraception.
Contraception or
Yes, yes. Ага. Necessary research method, да? No, the woman turn to the gynecology to select a method of contraception.
Yarina.
So with the what the C.
Maybe.
Because.
Who said?
One.
Who said?
Who said what? Girl.
You said. Who said?
Who said what?
Who spoke?
Joanna?
Joanna.
You correct? Yes. Yarina.
Yarina, it's me, guys. Come on.
Наконец-то
Why?
задача.
It's me.
Значит, почему Ярина, доктора?
Yarina.
Because
Yarina,
Because this woman have some hyperandrogenemia. Вот, oily skin with acne. Oily skin with acne. Because maybe not a syndrome of polycystic ovaries. Yes, because appends are not enlarged. But this is oily skin with acne. Yes, hyperandrogenemia. Yes, because we must recommend oral contraceptives with with anti-androgens component.
Yarina for 3 years and then
Yarina and so on, Belara, maybe. Да, Джосперинон and ciproterol acetate contains may have anti-androgens effects. Да, have you any questions?
Okay,
Так, yes. The next lesson we must know about menopausal syndrome, maybe climacterical syndrome. That's just the same. Menopausal or climacterical syndrome. You must prepare as usually 3 or 4 reports.
Okay, who next?
4 reports.
Next.
Dia nak tanya soalan.
Yes,
Okay.
and
Question.
yes.
okay, my question was which contraceptives for that patient to use, because there is the other one, danazol, of which it causes.
What this patient?
Yes, I was asking which one to use.
Yes, danazol, no, danazol.
Not danazol.
We
because
use
already
danazol to treat endometriosis.
endometriosis.
Yes, yes. Yeah.
But I was saying its side effect is oily skin with acne. I was asking which contraceptive to use. There is progestin and leucoprophene. Like I was asking which one to use in this case.
No, because we think that there are some hyperandrogenic signs. We must to recommend their anti-androgenic drugs. Maybe Yarina, maybe Belara, maybe something with anti-androgenic components.
Okay.
Components. Danazol.
Not tranazole.
Danazol is used to treat endometriosis.
Yes, yes, okay.
Isn't that like 3 days per year?
3 days.
Yes. Thus, to the next lesson, you must prepare 4 reports by climacterical syndrome or menopausal syndrome. Just the same. It's similar. Climacterical or menopausal syndrome. And you must make tasks from 5 to 8. Yes.
So,
Yes. No questions. Yes.